The Anatomage Table utilizes real cadavers and patients' CT and MRI scans to be virtually dissected fully in 3D. The form factor of the Anatomage Table allows users to visualize and interact with each of our cadavers in a full one-to-one life-size view. This is our Asian female cadaver, one of 4 cadavers that we have in the Anatomage Table. You'll notice that all of the tissues, colors, structures, and spatial relationships were taken directly from the cadaver, which allows our cadavers to be highly accurate. Any system or structure can be quickly accessed to identify a target piece of the anatomy. We can move layer by layer or structure by structure through any anatomical system in the body. All of our cadavers have their own inherent pathologies and abnormalities. This particular cadaver passed away from gastric cancer. We can identify the cancer by zooming in to take a look at the stomach of this cadaver. You'll notice that the thickening of white tissue towards the base of her stomach is where the cancer is concentrated, which actually blocked the passage of food from her stomach to the duodenum. So surgically, a GI fistula was created from the proximal loop of the jejunum to the base of the stomach. This allowed for food to be passed normally. Ultimately, she did pass away from complications of her cancer. Her cancer did metastasize along her spinal cord, and we can identify that by taking a sagittal slice of this cadaver. When zooming in, we can notice that there's some discoloration towards the thoracic portion of her spinal area. And you'll also notice that at her T1 vertebrae, there's almost virtually nothing left of it. A compression fracture was caused by the cancer metastasizing. With every cadaver that we have in this table, users can identify their pathologies and abnormalities. Every region of this contains highly accurate anatomy, faithfully reproduced from the cadaver. We can examine every region of these cadavers in a higher resolution. This is the high resolution head and neck region of our female cadaver. This is the same cadaver that passed away from gastric cancer. She also had other anatomical abnormalities that we can go and locate throughout her body. She had a large facial fracture caused by a force along her zygomatic bone. And there were screws implanted that were placed along her frontal bone, left zygomatic bone, left temporal bone, and the base of her maxilla. We can go in and identify these screws in both the 2D cross-sectional view and 3D gross anatomy view. We can get this kind of visualization since all of our cadavers were flash frozen at the time of death, where they were sliced axially in 0.2 millimeter segments. At each slice, a photograph was taken. We then stacked and segmented these photographs to create a fully interactive, highly detailed 3D cadaver. The visualization of 3D gross anatomy and 2D cross-sectional anatomy helps students with understanding these 2D to 3D relationships. For example, I can highlight the temporal bone, and you can start to see the outline in both the 2D cross-section and 3D gross anatomy. This helps prepare medical students to relate gross anatomy to radiological images and other modern methodologies for diagnosis that will be utilized later in their careers. This relationship has also been proven to help with student comprehension and understanding of image interpretation. Every region of these cadavers is highly detailed. We can examine the muscles affected by the facial fracture along the left orbital crest of the maxilla. We can see that the left levator labii superioris muscle could have been affected, specifically at the origin of the muscle. So we can examine the maxilla and have it be isolated from the rest of the structures around it. With the maxilla isolated, we can start to take a look and dive into more details of this structure. Specifically, I can start to pull up bone landmarks to better identify which structures might have been affected here. So, in speaking about the origin of the muscle, we would have noticed that there's an infraorbital foramen where one of the screws is placed along the left orbital crest. Now, we can also start to overlay that with the origins and insertions of each of the muscles along the maxilla. There's over 20 different muscle origins along the maxilla, causing it to be a very vital piece to facial structure. We can examine this level of detail for every structure in every cadaver in the table. The table ultimately allows for students to easily understand and visualize 3D relationships between different anatomical systems. Users can easily visualize complex regions of anatomy that would otherwise be a challenge to show with other resources. We will create a visual to show the arterial pathway to the circle of Willis, and we can identify target pieces of anatomy that should be included in our visual. So I can pull in specific categories of the skeletal system. I can also pull in specific areas of the arterial system that will allow us to identify the pathway. As well, I can pull in the CNS as a reference point for us to visualize this better. So now that we've completed our visual, we can start to examine the arterial pathways to the circle of Willis. The first step I want to do is expose the circle of Willis for us to better visualize. So we'll remove some of the structures starting at the mandible, the maxilla, some of the smaller bones in the nasal cavity, as well the palatine bones, the roof of the mouth. Now that these are all gone, we can remove the sphenoid to truly expose the circle of Willis, as well as we'll remove the occipital bone, the anterior longitudinal ligament, and the first cervical vertebrae. Now we can start to see the entire pathway to the circle of Willis. Starting at the base of the arterial system, you'll notice that we can highlight each of these structures individually, starting at the brachiocephalic trunk, moving into the common carotid arteries. I can highlight both the left and right independently, and each structure as they move up from the internal portion to the internal cavernous portion of both the left and right areas, both leading ultimately into the circle of Willis. We can also see blood flow coming up from the vertebral arteries, moving into the basilar artery, and then into the base of the circle of Willis. The circle of Willis ultimately acts as a traffic circle for the brain, allowing people to better highlight these structures and utilize them helps build a better understanding for students for them to utilize in class. Now, we can also highlight blood flow to any portion of the arterial system. And this ultimately helps build a better understanding and relationship for students to draw on later on when they're trying to remember this for tests or quizzes. Now, utilizing the table, we can get beautiful 3D views from multiple directions and orientations. Instead of just observing the circle of Willis from the inferior view that we have right now, we can also build into it a superior view. So what I'm going to do is I'm going to bring back in some of the structures that I've removed. And I'm also going to start to remove the CNS so that we can actually get a superior view of this cadaver. Now that I have a better superior view, we can see the circle of Willis from a different perspective, where I can highlight the circle of Willis blood flow into the ACA and into the PCA. Again, this is a tool to help you build relationships with students, provide them with visuals that they wouldn't be able to see elsewhere, and ultimately allow for a full 3D anatomical visualization of the full cardiovascular system. Using the Anatomage table, we're able to simplify complex pieces of information. We're able to visualize the pharyngeal region of this cadaver. And we can observe the complex relationships between the GI and respiratory systems. So, starting at the posterior portion, we can take a look and examine the GI tract specifically. So, we can start to see the nasopharynx towards the superior portion the oropharynx below, and the larynx below that. But with the muscles back on to visualize, we can actually start to pick this apart, removing each of these constrictor muscles from the superior, middle, and inferior to point out the purpose and ultimately the process for what they're used for. These muscles can actually help to push food into the esophagus down below. And we can highlight each of the portions and pieces of the anatomy to better visualize this. So now that we open up the posterior portion of the pharyngeal region, we can start to see inside, to take a look at the base of the uvula, the tongue, and we can even start to see the epiglottis and the base of the respiratory system. We can notice how closely these two systems are intertwined. We can understand the 3D relationships between the two. So now we can focus on this in a different type of visual. So we can have the 3D view of the gross anatomy on the left side, and we can start to get another 3D view on the right side, where we can get a laparoscopic view inside of the respiratory system. So starting at the nasopharynx, we can slowly move through the nasopharynx in to see the base of the pharyngeal mucosa and descend downward into the oropharynx, where we can start to see the epiglottis. Now, this is an important relationship to understand. As we move underneath the epiglottis, we can start to see down to the trachea and the rest of the respiratory tract. We can also manipulate the image on the left side to better get a visual of the anatomy inside of this area. And in particular, I can point out the epiglottis and start to talk about the importance this plays between the GI and respiratory systems. In particular, the epiglottis essentially covers the respiratory tract when food or water is being digested, so that you're able to safely move food to the esophagus without any moving into the trachea or the respiratory tract down here. Any of these structures can be identified, and we can actually get a better visual inside as we move through. So utilizing the table, we can start to build relationships between these two systems, understand them from different perspectives, and ultimately help prepare students for success that they would get from utilizing tools for diagnosis and other surgical procedures later in their careers. We can use the Anatomage Table to easily create lesson plans and prepare material for class. So what we're going to do here is we want to build a lesson plan around nerve innervation of the extraocular muscles of the eye. And so what I'll start off by doing is building a pathway that we'll want to visualize. So I'll start off by including all of the skeletal system minus a few pieces to help better see some of the structures we're trying to visualize. Next, I want to bring in the extraocular muscles of the eye that we want to show the nerve innervation of, as well as the CNS and cranial nerves 1 through 6. As well, we'll also want to be able to bring in the eyes for a reference point. So now that we've built what we're trying to visualize, I'm going to save this as a preset. We use presets as a way to build lesson plans, build quizzes, build any material that you would want to essentially save and come back to at a later time. And so while we're building this, we're going to be saving presets at every step that we go through. So I'm going to open up a few muscles to better understand layering of these different pieces of anatomy. So starting at the zygomatic bone, I'm going to remove the frontal bone as well, the sphenoid, the temporal, and start to remove some of the parts of the brain as well. So removing the temporal lobe and the frontal lobes should give us a good exposure to being able to see the major nerves CN3, CN4, and CN6 that innervate the extraocular muscles of the eye. So I'm also going to stop here and save another preset. So we can come back to this at any point, and this can be utilized to work into a worksheet or a lab activity where students have to follow a similar set of steps and patterns. But here I can quickly start to identify the 3 target nerves that we're going to look at: the oculomotor, the abducens, and the trochlear. You'll notice that each of their pathways gets highlighted as I click on them, so that we can easily see which nerve and which muscle are being connected. So in particular, One of the challenges, one of the things that we want to talk about is, which nerve innervates which muscle, and how do we get students to memorize this? So we can see the abducens nerve here clearly innervates the lateral rectus muscle. But how do we reinforce this for students? One of the ways that we can utilize the table is to easily make information more digestible. So what I can do is I can start to flat color different pieces and different structures here. So I can flat color the abducens and the lateral rectus with the same color to show that they have a relationship. The same can be done for the trochlear muscle that connects to the superior oblique muscle. And so I'm going to flat color these a different color to indicate that a different nerve is connected to these different points. So now that I have the trochlear up, let's say I'll highlight this one green and the superior oblique green as well. And then I want to distinguish that we are talking about the oculomotor, which innervates the other 6 muscles of the eye. And I will shade this one blue for now. So now we have a clear visual to show which nerves innervate which muscles of the eye. I'm going to go ahead and save this as a preset as well. Again, building the lesson plan that we will eventually come back to either work into a worksheet or into a quiz. So now that I've mentioned a quiz, one of the areas I want to jump to is being able to visualize a quiz and what that would look like on here. So I'm going to go ahead and drop some pins along the eye. And so each of these different pins is going to signify a different muscle that's being innervated by these different nerves. And so I've labeled 3 different muscles here: the superior oblique, the levator superioris, and the lateral rectus. And you can pose this question to students as to saying, all right, which of these muscles is innervated by which nerve? And then you can always say this as a preset for students to come back to as well. So at the end of your lesson, at the end of going through and reviewing this information, you can always quickly visit a quiz built around the same type of information you've been talking about in class. Now, we can take this a step further. Beyond just being able to do simple quizzes, simple testing, we can also start to explore anatomy on a micro scale. Let's say if I wanted to talk about the lateral rectus and talk about the specific histology slides and cases that go into this, I can start to pull in different pieces of histology that relate to any part of these cadavers. We have a histology library in our table that consists of over 1,000 histology slides ranging for every region of the cadaver's anatomy. And this is a great tool for students to be able to immediately relate 2D small cross-sectional slicing with 3D gross anatomy. And this helps build a relationship immediately so that you don't have to worry about students, forgetting what they're looking at or forgetting what they're going to be supposed to be seeing in a muscle and then relating it to the histology. This should serve as an immediate pathway for students to come up and actually recognize. The Anatomage table can be easily utilized to set up lab practicals and quizzes with all high-definition anatomy taken directly from a real cadaver. As you noticed when we set up the quiz at the end of our lesson utilizing extraocular muscles of the eye, we can do the same with any system in the body and be able to save that material for later use when needed. But we can also do a more interactive type of testing. Instead of dropping a pin on a structure and having it labeled as 1, 2, 3, 4, 5, etc., we can actually go in and have an interactive test using a more modern approach. We have several different types of tests we can do using the table, where simply we define which structures we want to have be included in the test, and then pick a module for how we want to have the test be executed. So for example, Pick Me is our traditional test where a student is prompted with a question as to, let's say, find the superior oblique of the eye, and then they have to go and identify that structure and hit submit. Flashcards is a similar setup, except of having the answer be recorded for later observance. We can have the answer be reviewed immediately, and the student will know if it was correct or incorrect. Multiple choice is a similar setup with multiple choices of answers for the different question that's posed. And then game mode's a little bit more unique, but I'll get into that a little bit later. Right now what I want to do is I want to go through a similar lesson to what we did, so reviewing the extraocular muscles of the eyes, but just in a flashcard mode. Now, there's one more part to this area that I want to mention. We can actually import a list of student names directly into the Anatomage table, so that if you had a class of, let's say, 20 students, you can upload your roster and have students come up here and select their name when they're going to be taking a test on here. So you have the ability to really dive in, easily record answers and results from your students, and be able to run metrics on that at a later time. Now, with flashcards, we don't necessarily need to pick a student name, but I'm going to go ahead and hit go for what we're going to be looking at. So this is going to test us directly on the muscles of the eye. So the superior rectus muscle, I'll go ahead and select where that is. What's great is it's going to show me a line to the correct structure, help identify it, and I still have a time to be able to move through the plane of the cut to help identify where that structure is actually located and be able to see what other structures are around it. Now, what about on the other side? The inferior rectus muscle. So let's say I didn't know which structure it was. In this case, I'm going to go ahead and get that incorrect. So you can see there's two things happening here. One, it's helping me to identify which structure was actually incorrect here, and which structure I should have recognized as the inferior rectus muscle. This is a really powerful tool, not only to help students in understanding what they're getting right and what they're getting wrong, but it can be a collaborative way for students to gather together around the table and study this information at the same time. This could be incorporated into lab activities, or it could be even utilized in full student assessments. Now, the best part about this is that you can actually run metrics. So you can see what kind of time has elapsed. You can record if a student has an answer correct or incorrect. And you'll also be able to see which structures the students are answering when they are prompted with a question. And then be able to export the results out at the end of the time. All of this comes together to help in improving student performance in class, in particular with understanding anatomy and being able to answer these types of questions. Ultimately, if students are able to have more fun while learning the anatomy, being able to study it better, this will help prepare them later for their careers. And as a result, the Anatomage table has been proven to raise student performance in test scores, just because they are retaining the information of anatomy better while utilizing the Anatomage table. The Anatomage table has numerous anatomical applications. Now, we've reviewed a number of things that we can do with the table. We've walked through the female cadaver in our gross anatomy. We've looked at the head and neck region of the high resolution anatomy of that cadaver. Now, I want to talk a little bit about what we can do with the Anatomage curriculum. We can upload any CT or MRI scan into the table and render it in 3D. What we've done is we've built a curriculum utilizing various CT scans to show off different regions of anatomy in radiological format. So within each of these different regions, we have multiple systems that can be identified and walked through. So I want to go ahead and start at the skeletal system and take a deeper dive into seeing what a CT scan looks like in the table and being able to take a look at the pathway we've drawn out and the curriculum that we have available. Every scan in the Anatomage table was taken directly from a real patient. What we're looking at here is a CT scan of a head and neck region. And so this is the skeletal system of the head and neck of our curriculum that we will be focusing on. So you'll notice that a few things that we are able to do. One, you'll notice on the right side of the screen, we can actually see 2D cross-sectional images from the CT scan. And you'll notice the orange bar on the left side is the 3D reconstruction of that CT. Essentially, our software will take the DICOM image and render it in 3D so that we're able to dissect it and we're able to go explore the anatomy similar to how we can explore the cadavers. So, what we can do is take a look, actually zoom in. I can actually start to pull in multiple systems of the body. So slowly pulling up on the actual density of the scan to be able to see the skin. And then slowly we can bring this down to start to take a look underneath. Being able to actually see the muscular tissue and the skeletal tissue. We're able to dissect this, very similar to how we can interact with the cadavers. Where I can actually rotate in, start to take a look inside the brain, a look through the spinal cord. And so the reason we have all these tools available for CT and MRI scans is that, one, it helps in understanding different ways of looking at anatomy, whether it's an actual pathology case or if someone's actually trying to do diagnosis on one of these scans. The table is FDA cleared to assist and render CT MRI scans for diagnostic purposes. Now, what we're here for right now, though, is we want to talk about how this can be utilized in our Anatomage curriculum. So what I'm going to do is I'm going to pull up our view sequencer. With this, we're able to actually take a look inside and go system by system through this. So we can start at the cervical vertebrae. Now, we're going to walk through this region, and we still can fully manipulate it, but we have a guided pathway to be able to go into the vertebral canal and then be able to render this same scan in multiple ways to expose different pieces of the anatomy. Then slowly we can make our way up the vertebral arch into the vertebral foramen, and then looking at the C1 and even into the base of the brain. So what's great about this is we have a guided pathway for us to walk region by region throughout the curriculum. The best part about this is that we have a full PDF that accompanies this area, highlighting the different annotations in each one of these different regions, and a 220-page outline for schools to immediately take and utilize for their own curriculums. The idea is that this is supposed to be a comprehensive amount of content for a full first year of anatomy, focusing on radiological images. The Anatomage curriculum is one component that schools can utilize to better integrate the table into their schools. Now, the table does have a large amount of content that is accessible. There are over 1,200 CT and MRI scans that schools can start to utilize as pathology cases or just simply to look up, normal pieces of anatomy in radiological format. We have a case library where everything is organized by different region in the body. So starting at the head and neck, we can walk through MRIs of the brain or facial fractures. We can also start to look at CT and MRI scans within the thorax or the abdomen. We can also see full body CT scans and examine different patient ages, different patient sizes and body types, as well as we can look at extremities. But we can also start to bring in rare and unique cases when we look through our library. We have embryology for stages 13 through 23, as well as a few fetal scans to also bring those in for review. We even have veterinary examples with a cat, dog, frog, and sliced mouse that actually utilize real cadaver tissue similar to our human cadavers. We can even go in and show comparison cases between what a pathology case would look like side by side with normal anatomy to get a better in-depth understanding of what a pathology might look like. What we're going to explore next is an abdominal aneurysm case where we can see 3 cases laid out side by side and get a better understanding of what each of these cases looks like and the anatomical differences between them. Now we are looking at an abdominal aortic aneurysm comparison case. We have 3 different scans laid out side by side to allow us to fully demonstrate and exhibit what the anatomy of an aortic aneurysm looks like. So we're going to start in the upper right-hand corner, looking at what normal anatomy should look like. So you'll first notice that the aorta itself is in a medial position along the spinal cord. The iliac arteries down below are both straight, and there's no visible pathologies associated with any part of this scan. By comparison, when we look at the scan below, this demonstrates the abdominal aortic aneurysm. We can see that the aorta has become dilated and has moved away from the medial position on top of the spinal cord. You can see that there's been a pressure that's been built up, and that has affected the iliac arteries down below. So there's a number of notable pathologies that we can observe visibly just by looking at this. Now, by comparison, we can also start to compare this to what a post-operative example might look like. This is an abdominal aortic aneurysm where a stent has been placed around the aorta and the base of the iliac arteries. The stent was in place to hopefully alleviate the aneurysm, contain the aorta, and strengthen the wall for it to be able to heal. Now, this also is a demonstration of another pathology because there is an endoleak within the stent itself. You'll notice that the aorta is starting to break through the stent, and so that's part of the reason why this scan was taken. Each of these different scans is from a real patient and exhibits a certain pathology or certain piece of anatomical information we can help to piece together and better understand what the effects of an abdominal aortic aneurysm are. Ultimately, this type of example and the other examples in our library are helpful for students to gather information and draw on later when they are going to be going down into their careers in medicine to better understand what a pathology could look like. The Anatomage Table can upload CT or MRI scans for medical diagnosis. And so I want to pull in another example from our case library. Here we have a head MRI. This will look a little different than the CT scan we examined previously, since it will focus on more of the softer parts of the anatomy. So we'll actually be able to see lobes of the brain, as well as larger nerves and the actual eyeballs here. So what we can do is we can actually see the MRI fully in 3D, side by side with the 2D cross-sectional information from the DICOM file. And so similar to the CT scans, we can interact with this, relate 3D to 2D immediately, and build a stronger relationship between the two. For students, 3D comprehension of CT scans is a challenging topic. And so exposing them to this type of information and this type of tools allows them to better succeed in their careers. So when we're working with this MRI scan, I have a number of tools to be able to dissect through it, to diagnose it. Luckily, this particular scan is normal in most aspects of its anatomy. I can go in and actually start to pull in a bit more detail so we can actually see small facial structures on the skin. As well, I can actually start to do some dissections directly on the scan. So first off, I'll make a dissection through the skull and skin to start to take a look at the temporal lobe underneath. Now that we can see that, I want to do this a bit further. So I want to actually eliminate the entire skull to have the brain be exposed by itself. Now that we can see this, we can start to see the frontal lobe, we can start to see the brainstem. And if I continue to dissect it a bit further, we could take a look inside and start to see more minute details within the brain. We can see the corpus callosum, we can see the thalamus, the lateral ventricle here. All of these different components we can get just from an MRI scan. As well, there are people and there are institutions that are using the Anatomage Table to take it a step further. Some places are using the table for medical diagnosis and pre-surgical planning, where they'll walk through a CT scan with both the radiology and surgical team to have everyone be on the same page prior to going into surgery. This is an extremely powerful tool for students. One, because of all the gross anatomy, the high-res anatomy, all of the highly accurate and detailed anatomy that we have from our cadavers and our case library. There's also a proven effectiveness with this table to improve student test scores and improve anatomical comprehension of complex information. As well, the Anatomage Table thoroughly prepares students for success in their careers.